there's an issue that sort of arose that gives me some concern, and that is just the recent evolution of the recommendation from the CDC to provide the COVID vaccine for children above the ages of 6, along with the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians, making that recommendation. Under our current statutes, it allows now under 19A-7F for the Commissioner of Public Health to add that to the school schedule without the need to go through regs review or legislative review prior to that recommendation from happening. I'm asking that this committee take a look at it and suggest that we revise this statute in light of the removal of the religious exemption. Back when the flu vaccine was recommended for children under the age of 5 months in 2010, this statute was utilized to recommend it for that age children and make it a requirement for pre-K in our state. I believe that led to a rise in the utilization of the REs because parents didn't want to give their children the flu vaccine. And as you all know, that evolution caused the long protracted debate over the decade of whether or not we should keep the RE. I have concern that should this statute be utilized in this manner, that we potentially would see mass exodus from schools, because I don't think parents will give this option. We already see statistically it's under a third of parents are administering the COVID vaccine to their children. And given the fact that we have yet to address the issue of giving an educational opportunity for people that choose not to vaccinate their children, I think the state of Connecticut needs to look at this holistically. And so I'm asking that you take a look at this issue in the tech revisor. I would have raised this bill on my own, but the issue arose subsequent to bill submittals when the CDC made their recommendation. And so with that, I'd be happy to answer any questions.
Sure.
Thank Senator Summers.
Yes, good morning. Thank you for bringing this important issue, out in the open. I know that, being on this committee for the last 8 years now, you were also on the committee, and we had bills in the past, even if the CDC did recommend a particular vaccine to be added, we always heard it as a bill. Do you remember that? And there was legislative input, we had public hearings on it. I remember it specifically for
HPV,
and there was another one. I think it was for meningitis in colleges. Right. So, but now we have changed the statute so that process doesn't really occur any longer. It could, but it doesn't according to the way that this is written. And that has been a concern of mine and many of us. And for many reasons, this is why some people voted no on that vaccine bill, actually, in particular, because of the way that the language was written. And I will say, I do agree with you. I've heard from not only families in public or private school, but in private daycare facilities that are taking it upon themselves now. And I know that I'm sure the Office of Early Childhood has heard this, making their own requirements saying, if you are not vaccinated for COVID, you cannot come here. So I think that's also troubling that we have private institutions creating their own requirements around what vaccinations are required. And I know that UConn, for example, I've had a lot of comments on that, requires the COVID vaccine for students, but does not require it for their professors any longer. And they do allow for medical exemptions, but if you didn't get them in by a certain date, it's no longer valid. So I would like to see that regardless of what happens, and I have had conversations with the DPH office in writing, where the commissioner has said at this time, this is not something that she thinks should be added to the schedule, but that could change as a commissioner changes. And I think it's important that we, look at this so that if we are going to make these determinations, like you said, there is a public hearing, public input, and the legislature has input on what would be required. So I really thank you for bringing this to us.
Representative Zupkus.
Thank you, Mr. Chair. I'll be quick. Thank you for coming today. And as Representative Carpino said, bringing this. because my constituents reach out to me all the time about these issues. But can you just tell me, kind of following what Representative Clara DeCitria was talking about, why is there this ambiguity out there on how the commissioner can do it on their own, just regarding this whole thing? What's
So because I think there is ambiguity in it, but if you look at 19A 7F, it's the public health commissioner shall determine the standard of care for immunization for the children of this state. That standard of care is defined by the recommendation of vaccine schedules from the CDC, from the American Pediatrics, and from the American Academy of Family Physicians. So once those three groups recommend the vaccine on the schedule, that now defines the standard of care and gives the commissioner the authority to add that to the list. What then follows, though, after that process is once it's required, it then goes through regs review, but it's already been required by that ministerial act from the agency. So while one might say, well, we go through regs review, at that point, it's a fait accompli because it's already been added. And my concern is, 10 years ago or even 4 years ago, it wasn't as impactful because people would just file an RE, a religious exemption, and their children could continue to go to school. With the removal of the religious exemption, and I say this because, I was on the committee when we went through that process and met with the public health commissioner at that time, several meetings, pulled data, looked at the information. A lot of REs were filed at the pre-K level. And so when you were looking at those REs, they were submitted into the schools. They might be in their preschool program. Once they entered kindergarten, those REs may still have been on file. When we looked at the 7th grade data, a lot of our non-compliant or children that were filing REs, then all of a sudden were compliant by 7th grade because we were only taking snapshots of who had their paperwork in and who didn't. That led to sort of an appearance that I think there were a lot more people utilizing the RE than was actually happening. Because a lot of parents exercise the RE for preschool, because giving a flu vaccine is very different from, getting your mumps, measles, your smallpox vaccine. And I think that COVID right now statistically is tracking and even worse than the flu vaccine. Parents are not giving it to their children. And because the religious exemption is gone, this could potentially have a very big impact. And I go back to, Senator Summers' references of debates on HPV. We're in that situation potentially with any vaccine that now gets added to the schedule. It could cause children to be removed from school, even if it's not even a communicable disease. And so I think we've got to look at this because what's frustrating, it's not your purview here. Our caucus has been trying to give an alternative to children that can't go to school. And we've been trying to get the virtual platform for children who can't go to school because of either lack of immunization or a medical issue. That bill has stalled. There's been a huge fiscal note put on it. It hasn't been moved forward. And we have a hard enough time right now post-COVID with chronic absenteeism. We've got to pull our schools out of crisis.